Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today our topic of discussion is about a rare eye disease which affects children between the age group of 4 to 6 years. That is FEVR, Familial Exudative Vitreoretinopathy. So let's talk about this disease. We talk about FEVR, it is inherited disease. It can have autosomal dominant, recessive or X-linked, but predominantly it is autosomal dominant. And usually it affects children between 4, 5 or 6 years of age group. The pattern is same as we have seen in ROP, and that the blood vessels are not going in the periphery of the retina. And because of not reaching up to the periphery of the retina, ischemia happens over there. And when oxygen is not supplied in that area of the peripheral retina, because the blood vessels are not going over there, the ischemic VEGF factors are released. So new vessels are formed over there. And new vessels are formed, they can lead to vitreoretinal traction, retinal detachment, all these things. So if we talk about the presentation is almost the same as we talk about in ROP. But these children do not stay in, if you take the history, they will not give any history of prematurity. ROP is a disease of prematurity where children are spend time in intensive cares and they are put to the supplemental excessive oxygen and then they develop that disease. But in FEVR, they are full-term babies. They do not stay in intensive care, but they have an inherited pattern. In their family history, people also have such disease. So what happens when the blood vessels don't go up to there in the periphery? Usually the temporal side of the retina is involved, but it is very much possible that this disease, avascular area, where the area of the retina without blood vessels is 360 degrees. So new vessels are formed, and whenever there is new vessels formation, there is fibrous traction, bands formed over there, and these fibrovascular bands can happen over there and they can lead to the tractional retinal detachment. If you look towards the blood vessels, in the temporal side, there is straightening of the blood vessels. Yes, there is straightening of the blood vessels and the macula is dragged temporally from its normal location. Yes, it's dragged from there. And at the junction of vascular area and avascular area, we will find abnormal blood vessels. So all these things are happening. The presentation is, as I mentioned earlier, the same presentation except the full-term babies and that they are not prematures and no sickness, nothing like that, intensive care, no history of like that. And the presentation is between 4 to 6 years. Question that arises, how to manage these patients? And in management, first of all, investigation. We have to examine this patient fully dilated, and we have to see the peripheral areas especially, because this disease is affecting the peripheral areas. And even if we have to do scleral indentation, we should go for it. And all those peripheral ischemic areas should be properly documented. Number 2, wide field fluorescein angiography. Nowadays, it's a facility available. It should be done as shown in this photograph. Here we can see that the blood vessels in the temporal sides are coming to a halt over there. And this abrupt halt of the blood vessels is causing ischemia over there in the periphery. It is not covering the peripheral area. And once this ischemia is over there, VEGF will be released, which will lead to new vessels, and all those things will happen: tractional retinal detachment, fibrosis, blood hemorrhaging, exudates, all these things will happen. So wide field fluorescein angiography, that is very helpful. Also, we can do OCT macula. OCT macula will tell us about vitreomacular traction, vitreopapillary traction, and also, as shown in this photograph, multiple levels of macular edema. So these things are very important. Now, when we talk about the management of these patients, it depends at which stage they have presented to us. If it is just the ischemic areas over there, these patients can be observed for further signs of new blood vessels development. But in stage 2, there is new vascularization over there. Stage 3 and stage 4, there is subtotal retinal detachment. But the difference is that in stage 3, the detachment is outside macula. And in stage 4, subtotal involving the macula. And stage 5 is the total macular detachment. So what happens over there, that in stage 1, as I mentioned, we should observe these patients and see whether they develop new vascularization or not. This disease is mostly active in children's, and we can say in adults group up till 20 years of age. And later on in the life, they come to the static phase. They don't present as aggressive as in the children. So in stage 2, when there is a new vascularization over there, these peripheral areas can be, lasers can be applied over there. And once lasers are applied on those ischemic retina, there will be no more release of VGFs and no more blood vessels will be formed. Stage 3 and stage 4, as I mentioned, there is a subtotal retinal detachment depending upon the which area. Anti-VGFs are tried, but it is controversial role because applying anti-VGFs can further aggravate the vitreomacular traction, and it can lead to tractional retinal detachment. It can lead to the worsening. So some people have tried it up till stage 3A, but it has chances of worsening the vitreoretinal traction. And once there is retinal detachment, as I mentioned, then the surgeon has to go surgically. He can apply whatever approach he feels, scleral buckling or internal approach. It has to be done. Yes. Usually patients presents very late and the prognosis is not that much very good. But if they present earlier and the treatment is starting, useful vision can still be preserved. So, dear audience, today that was our topic of presentation. That's FEVR, Familial Exudative Vitreoretinopathy, a rare disease. And all the family members should also be examined. As I mentioned, sometimes asymptomatic over there, but it has an inheritance pattern. So they may be also having this disease. And if timely management is done over there, very useful vision can still be preserved in these patients. Yes. And I hope my today's presentation will be beneficial for my respected audience. I want to thank you for your attendance and attention. Thank you.